Hey everyone, and welcome back to the channel. I'm Kamar Shahzad, and today we're tackling a topic that is incredibly important. Something that could genuinely empower you to save a life: cardiopulmonary resuscitation, or CPR, specifically in the context of a suspected heart attack. It's a scenario none of us want to imagine, but being prepared can make all the difference. Knowing the correct steps and acting decisively transforms you from a bystander into a first responder, a crucial link in the chain of survival. Many people feel intimidated by CPR, thinking it's too complex, but I'm here to break it down for you. This isn't just about going through motions, it's about understanding why each step matters. When someone's heart stops, every second counts. The brain and other vital organs are deprived of oxygen, and the window for a positive outcome shrinks rapidly. CPR, performed correctly, keeps oxygenated blood flowing to those organs, buying precious time until professional medical help can arrive and take over. It's a bridge, a vital intervention that you can provide using nothing more than your own two hands and the knowledge we're about to share. In this video, we'll walk you through the essential steps to perform CPR on a heart attack patient. Remember, acting quickly can save a life. We'll cover everything from initially assessing the situation to performing effective chest compressions and, if you're trained, rescue breaths. My goal is to make this information accessible and clear, so you feel confident and prepared. So let's get straight into it and learn how you can be a lifesaver. Alright, so you've encountered a situation where someone has collapsed, and you suspect it might be a heart attack leading to cardiac arrest. The very first thing you need to do, even before thinking about CPR, is to ensure the scene is safe for you. Look around quickly. Are there any immediate dangers like traffic, electrical hazards, or falling objects? Your safety is paramount because you can't help anyone if you become a victim yourself. Once you've confirmed the scene is safe to approach, then, and only then, do you move on to assessing the individual. This initial check is absolutely critical. Now let's talk about how to actually check for responsiveness. You're going to approach the person, and you'll want to tap them firmly on the shoulder. As you're tapping, shout clearly, "Are you okay? Can you hear me?" You're looking for any kind of response, eye-opening, a verbal answer, a groan, any movement. At the same time, you need to quickly scan their chest for signs of normal breathing. Is their chest rising and falling regularly? Be careful here, because agonal breathing, which can look like gasping or snorting, is not normal breathing and is a sign of cardiac arrest. This entire check should take no more than 5 to 10 seconds. If the person doesn't respond to your taps and shouts, and they are either not breathing at all or only making those gasping sounds, you must assume it's a cardiac arrest and that CPR is needed immediately. Don't waste time looking for a pulse. Current guidelines for lay rescuers emphasize starting CPR quickly if unresponsiveness and abnormal or absent breathing are present. This quick assessment is the trigger for the entire chain of survival. Every moment from this point forward is precious, so making this determination swiftly and accurately is key to giving them the best possible chance. So, you've determined the person is unresponsive and not breathing normally. The very next and equally critical step is to call for professional medical help. You cannot manage this situation alone indefinitely, and the person needs advanced care as soon as possible. This means immediately contacting your local emergency services. In Pakistan, that number is 1122. In many other parts of the world, like the United States, it's 911. Know your local emergency number. It's information that everyone should have readily available. Time is of the essence, and getting paramedics on their way is a top priority. When you make that call, or if you direct someone else to make it, be clear and concise. State your location as precisely as possible. Address, landmarks, anything that will help them find you quickly. Tell them that you have an unresponsive adult who is not breathing normally, and that you are starting or about to start CPR. Answer any questions the dispatcher asks. They might also be able to provide instructions over the phone to guide you, which can be incredibly helpful, especially if you're feeling overwhelmed. Don't hang up until the dispatcher tells you to. Ideally, if there's someone else nearby, point directly at them and say, "You, call 1122 or 911 right now, and tell them we have an unresponsive adult. Come back and let me know they're on their way, and if there's an AED nearby, please bring it." Delegating this task allows you to start chest compressions sooner. If you are alone, you'll need to make the call yourself. Use your mobile phone on speaker mode if possible so you can start CPR while talking to the dispatcher. the key is to activate the emergency response system without any unnecessary delay. Chapter 3. Step 3. Begin chest compressions, the heart of CPR. Now we get to the core of CPR chest compressions. For an adult in cardiac arrest, high-quality chest compressions are arguably the most important intervention a bystander can provide. When the heart stops beating effectively, it's no longer pumping oxygenated blood to the brain and other vital organs. Your compressions are essentially taking over that job. You are manually squeezing the heart between the breastbone and the spine, forcing blood out to the body. This is what keeps those vital organs alive until more advanced medical treatment, like defibrillation, can be administered. So don't underestimate the power of good, effective compressions. Let's get into the technique. You'll need to position the person on their back on a firm, flat surface. If they're on a soft bed, try to move them to the floor if possible, or place a firm board underneath them. Kneel beside their chest. Place the heel of one of your hands directly in the center of their chest, on the lower half of the breastbone, sternum. Place your other hand on top of the first hand and interlock your fingers or keep them extended and off the chest. Your shoulders should be directly over your hands with your elbows locked straight. This allows you to use your body weight, not just your arm muscles, to perform the compressions, which is much more effective and less tiring. The specifics of the compressions are crucial for them to be effective. You need to push hard and fast. For an adult, hard means compressing the chest at least 2 inches or 5 centimeters deep. Don't be afraid of pushing too hard. The risk of injury is minimal compared to the certainty of death if effective CPR isn't performed. Fast means a rate of 100 to 120 compressions per minute. A good way to keep this rhythm is to think of the beat of the song "Staying Alive" by the Bee Gees. Equally important is allowing the chest to fully recoil or return to its normal position between each compression. This allows the heart to refill with blood. Push hard, push fast, and allow for full recoil. Chapter 4, Step 4, Rescue Breaths, if you're trained and able. After you've delivered 30 high-quality chest compressions, the next step, if you are trained and feel comfortable doing so, involves giving rescue breaths. The primary purpose of rescue breaths is to deliver oxygen into the person's lungs, which then gets circulated around the body by your chest compressions. While chest compressions are the absolute priority, especially in the initial minutes of adult cardiac arrest, adding breaths can provide additional benefit if done correctly and without significant interruption to compressions. However, I want to strongly emphasize that if you are not trained in giving rescue breaths, or if you are unwilling or hesitant for any reason, you should continue with compression-only CPR. Continuous compressions are far better than no CPR at all. If you're going to give rescue breaths, here's how you do it. After your 30 compressions, you'll quickly open the airway using the head tilt chin lift maneuver. Place one hand on their forehead and gently tilt their head back. With your other hand, use your fingertips to lift the chin. This action lifts the tongue away from the back of the throat, clearing the airway. Then pinch the person's nose shut with the fingers of the hand that's on their forehead. Take a normal breath, not a deep gasp. Make a complete seal over their mouth with your mouth, and give one breath lasting about 1 second, just enough to make their chest visibly rise. Watch for that chest rise. It's your indicator that air is getting in. If the chest doesn't rise, reposition the airway, retilt the head and lift the chin, and try again. Give a second breath, also making the chest rise. Each breath should only take about 1 second. The transition from compressions to breaths and back to compressions should be as quick as possible, aiming for minimal interruption, ideally less than 10 seconds for both breaths. Again, if you're not trained or are uncomfortable, skip the breaths and just keep pushing hard and fast on the chest. Your compressions are paramount. Chapter 5. Step 5. Continue CPR. Persistence is key. Once you've started the cycle of 30 compressions and 2 rescue breaths, or continuous compressions if you're doing compression-only CPR, the key is to continue with minimal interruption. Persistence is absolutely vital. CPR is physically demanding, but every cycle you complete is another chance for the person. You're going to keep repeating these cycles of 30 compressions followed by 2 breaths, if you're providing them, over and over again. Don't stop to check for a pulse or signs of life frequently. This wastes valuable time when compressions could be circulating blood. Trust the process and keep going. You should continue performing CPR until one of a few things happens. The most common scenario is that professional emergency medical services arrive and are ready to take over. They will have advanced equipment and expertise. Another reason to stop would be if an automated external defibrillator, AED, becomes available and is ready to use. We'll talk more about AEDs in the outro. You would also stop if the person begins to show definitive signs of life, such as opening their eyes, moving purposefully, or breathing normally on their own. This is different from the agonal gasps we mentioned earlier. If they start breathing normally, you can stop CPR but continue to monitor them closely until help arrives. Performing CPR effectively for an extended period can be exhausting. If there's another person present who is also trained in CPR, you should switch roles approximately every 2 minutes, or after about 5 cycles of 30 to 2. This helps to prevent fatigue and ensures that the chest compressions remain high quality, deep enough and fast enough. When switching, do it as quickly as possible to minimize any pause in compressions. The person taking over should immediately start with chest compressions. Remember, continuous, high-quality CPR is their best hope until advanced care is available. Outro, you did it! Next steps and staying prepared. So, that's a comprehensive walkthrough of the essential steps for performing CPR on an adult experiencing a heart attack leading to cardiac arrest. It might seem like a lot of information, but remember, at its core, it's about acting quickly, calling for help, pushing hard and fast in the center of the chest, and continuing until help arrives or the person shows signs of life. You truly have the power to make a difference in such a critical situation. Your willingness to act can be the bridge between life and death for someone. Do not stop CPR unless the person shows signs of life or medical help arrives. If an AED, automated external defibrillator, is available, use it as soon as possible. AEDs are designed to be used by laypeople and provide voice prompts to guide you. They can analyze the heart's rhythm and deliver an electrical shock if needed, which can be life-saving. If an AED arrives, turn it on and follow its instructions immediately. While this video provides crucial information, I strongly encourage everyone to take a certified hands-on CPR and AED course. Practical training will give you the confidence and muscle memory to act effectively if you're ever faced with this emergency. Thank you so much for watching and for taking the time to learn these life-saving skills. I hope you found this guide helpful and empowering. Remember, preparation is key. Knowing what to do can